One-to-One Health presents a guided tour of the digital health information ecosystem. My name is Seth Levine. I'm the Vice President Director of One-to-One Health, and I'll be your tour guide. Just a few years ago, if you had a corporate website and a brand or product site, you were doing what you needed to do to check the web marketing box. But new technology and rapidly evolving online behaviors gave rise to better search algorithms and lowered critical barriers to the creation of content, both by professional creators and users. Suddenly, there were new paths to customers for marketers to think about, and new tactics to be added to marketing plans. The pace of technical innovation and behavior change has only increased, enabling users to contribute as much as they consume, and to make their online experience their own and interact with the internet when, how, and where they choose. What marketers are now faced with is an often overwhelming targeting opportunity and an equally daunting focus, features, funding challenge when it comes to their marketing plans. This is especially acute when it comes to health and healthcare, because the potential audience is an audience of everyone. In addition to our familial and professional roles, ultimately, we are all patients. According to Comscore, Forrester, and Pew, among online Americans, 41% have read someone else's opinion about a health experience or medical issue. 24% have read health-related reviews or rankings. 80% have researched prescription drugs online. 79% use the internet as a research tool before speaking with their doctor. And of that, 60% have consulted social media. All of these activities are happening in what we at One-to-One Health call the digital health information ecosystem. And in it, the possible connections between content and are infinite and critically relevant. These connections between content and interactions between users now influence our consideration process. What we are exposed to into the ecosystem goes into a kind of consciousness mill, and from this mill ultimately come decisions and actions. The inputs are many, and like the universe, the digital health information ecosystem is growing each and every day. Let's take a look around the digital health information ecosystem. I'm going to highlight just a few of its nodes. We all know about search engines. They've become our primary GPS for seeking in the ecosystem. They connect us to just about everything in it. And with the integration of multimedia into search results, they have become the definitive resource for health info seeking. Patient support forums have proliferated in Web 2.0 and now Web 3.0. There is a site for every type of patient in virtually every condition. Video sites like YouTube, microblogging through services like Twitter, and social network sites like Facebook are increasingly places where health information can be found and where health dialogues happen. Location-based marketing is now beginning to play in wellness and couponing. The proliferation of mobile has arguably had the most significant impact on the consumption and creation of content in the past 18 to 24 months. In fact, according to the Pew Internet Life Project, more Americans own mobile phones than computers. And according to Forrester, better than 1/4 of all Americans own smartphones like the iPhone or BlackBerry, and that's expected to double in less than 2 years. Syndication and tagging has also had a massive multiplier effect online, exposing people to dozens of links in the blink of an eye. Health sites like WebMD and general interest in news sites such as CNN.com have long been sources of health news. But due to evolving content and user behaviors, they are becoming the first-line source of medical information for most Americans. The next two nodes are ones that just a few years ago seemed to be unlikely fits for health and healthcare. But as it turns out, medical professionals are people too, and doctors, nurses, and pharmacists recognized the professional value of social integration and interaction online. Now we have sites like Sermo and Osmosis. And health products aren't the only things being reviewed and ranked online. Now you can speak your mind and score doctors and healthcare institutions. So why is it critically important for marketers to understand the digital health information ecosystem? Because there has been a behavioral sea change in the way that people access and share information that is technology enabled but human nature driven. And because Your target customers, patients and professionals alike, aren't just influenced by what they read in 1 or 2 places online, or even 3, 4, or 5. Let's consider a few examples. Cynthia Andrews is a patient with Crohn's disease. She's 26, in grad school, and very active. Her Crohn's doesn't slow her down, but it's something that definitely impacts her life. But she doesn't hide from her condition. Instead, she uses a Facebook group to learn and share, a new Crohn's app on her iPhone to help manage her condition, and various sites to monitor research and treatments. She's informed, motivated, and mobile. Leticia Cruz is a mother of 3. Having 3 kids under the age of 6 means that she plays the role of Dr. Mom all of the time. Although she's fortunate that none of her children have chronic conditions, she's constantly monitoring health news and researching treatments from everything from poison ivy to diaper rash to eczema, and she does this on health sites like familydoctor.org. She sees the information that she gets from the moms who participate in the Nest.com's parenting board as critical to keeping her informed on health issues, and she regularly visits couponcabin.com to get coupons for over-the-counter medicine. Dr. Michael Willis is a cardiologist. He's been online since the beginning and has been an iPhone owner since it came out. He is primarily online for professional reasons, reading journal articles, participating in discussion groups on Sermo's cardiology forum, and while he doesn't take meetings from drug company reps, he's willing to review e-details they send him, which he does in the evenings. During the day, his iPhone 4G is his primary screen, and on it, he has over a dozen medical apps, including Hippocrates and ReachMD. Raymond Chang is the Director of Diagnostic Imaging Services at a major metropolitan hospital that also has 6 outpatient sites. So suffice it to say, he's not in his office very often. Sales reps want 2 minutes of his time all of the time, and that just doesn't work for Ray. He's often actually interested in what they have to say. He consumes information, but on his terms. HealthImaging.com and an imaging news blog are his primary professional news sources. Even out of the office, he relies on these sources, subscribing to their RSS feeds, which he reads on his BlackBerry. If something he sees there piques his interest, he might go search for more information on a product site. Cynthia, Leticia, Dr. Willis, and Raymond are just a few of your prospects and customers. They aren't profiles or segments, they're people, and like snowflakes, every person online is different. So what do you do? Where do you prospect? How do you communicate to retain customers? How do you focus resources, dollars, and effort in the digital health information ecosystem? For health brands, companies, institutions, and marketers, things have changed. Thinking needs to also. For those ready to embrace the new behavioral paradigms represented in Web 3.0, they need a partner who can help them navigate the digital health information ecosystem, understand human behavior, technology, and tactics, execute effective, creative, and compliant programs, ensure integration between online and offline efforts, and identify the means by which to understand productivity and ROI. For those ready to think differently and market smartly in the digital health information ecosystem, it begins with a one-to-one conversation with us. We are a full-service digital agency offering strategy, creative, and the ability to execute in-house in any digital channel. We have over a decade of experience in health and pharma. To find out more, visit www.otoihealth.com. You can follow us on Twitter as One-to-One Health. We love talking about health, the power of digital, and business challenges. So if you'd like to meet with us during the Connected Health Symposium, text OTO Health to 50500, and I'll reply to make arrangements. Thank you very much for your time.